So this is my list. It's very, very condensed. This is for you to have in your emergency manual as a checklist. So not so much as a presentation. You all should get a copy of this if you have not already from Eleanor. Okay, so this is just a summary of the more detailed slides we went through, but this has more of an extensive list of specific supplies, and I'm just going to scroll through them, and if you don't recognize something, I can tell you what it is, what it's for, and I have my Google here ready to pull up. I can do images if you want to see what it looks like, because I didn't know what people wouldn't know. I didn't download pictures for every single thing, so that would take forever. But I'm glad to pull something up kind of on the spot. All right, and so everybody needs to have BLS certification. As residents, I believe you all did this prior to graduation, so you should be good. Mo says it's every,
I think it's every
2 years that you're supposed to get it renewed. So stay on top of that. Pretty basic stuff. If you do more advanced, higher course intervention, particularly if you are like our friend Brendan, who does a lot of really fancy IV therapy work, you should have your ACLS training. Canada has their NCLS certification specifically for NDs, and there is ACLS training certification. You can look online here in Seattle. There's classes every month. I listed a few of those places that do offer the training. It's kind of a gray area whether an ND can actually hold the certification, but you can get the training. All medical staff should have training on the equipment that you carry specifically. So you can't be content just to say, do you know how to use an AED? Well, every AED is different, and so some are more manual, some like this one are more automatic. So make sure that you guys have regular training on your AEDs, O2 tanks, nebulizer, injection vials, airway support, which is why I brought all mine for those of you who took a look already, so you can kind of get an idea of, like some of you have never seen my kind of oxygen tank before. And so make sure that's something you know where to find, how to use in your clinic. Make sure you have standard operating procedures. These are living documents. In my clinic, we use a Google document that can be updated regularly with standard operating procedures and a searchable PDF. And so that way things can be rapidly found by the front desk person who always has an updated copy saved on their computer. Again, it's all about managing. What's the most important thing to know beforehand is what is your role. Good. Got to know your role in an emergency. Who will call 911? Who is going to run and get the crash cart? Who will contact the owner or clinic director? Each clinic will have unique needs, so I can't tell you what to do for your situation. You just have to figure it out, make a plan, and stick to it. Practice your plan periodically, at least once per year, or once every time you have a significant new hire who will be part of your process. Create a practice scenario, drill the scenario, and then have people grab your actual supplies. And then during that drill, you'll be able to see, are the supplies expired? Are we doing a good job with keeping that up? We found one expired epinephrine vial in my bag, so that's why you got to pull them out and do these drills frequently. Have a scheduled maintenance of your equipment. And then aggregate your resources for urgent needs. Other than supplies, particularly new docs, the most important resource is a mentor that you can call. Now, we all consider Paul Anderson to be our mentor, but he can't take calls from us, all of us, all day. As much as he's willing to do so, it's just not physically possible. So preferably a mentor that is close to you, a personal friend, a personal acquaintance, someone you've worked with previously. I have associates and residents who have worked for me in the past. They went and did their own thing, but they still call me frequently. because I was involved in their initial training, and I'm okay with that. Make sure your mentor knows that they are your mentor, right? Sometimes maybe I don't want everybody I've ever preceptored to call me, right? And so make sure they're okay just by asking, are you okay if I call you in emergencies? Can I have your cell phone? Make sure that that's clear and that you're not just calling someone out of the blue and maybe they won't take your call or something like that. Have experts you can call, right? Who is your favorite radiologist? That's a big, important one. I work with Dr. Jacobs, Bellevue Medical Imaging, and I've been working with him for the last 10 years. We have a relationship where I can call and say, hey Brian, I don't know what to do here. Can you help me out? You know, what order should I do these images in? What's most important? Help me with the differential. Because, you know, he's got now he's got 30 years of experience. He's a wealth of information. CDI has Dr. K. What's his Demas, Cal Demas, right? Super nice guy. Make a relationship with these doctors. Have that expert, you know, especially things that we don't refer to often. Like I rarely refer to a urologist because I do men's health. But every once in a while, someone needs a robotic prostatectomy, you know. And so Dr. Lee in Bellevue, he's my guy. And he's, you know, ND friendly, or at least he doesn't talk crap about me to my patients, you know. So you need a list of experts in your tangential fields. If you do women's health, who's a OBGYN surgeon if someone needs to have an ablation or fibroid removal? Are they gonna tell your patient that your bioidentical hormones that you have them on are going to cause breast cancer and they should not see you anymore? You need to know, you know, who you're referring to, what their stance is on naturopathic medicine, functional medicine, so that when you do have an emergency or an acute situation, you have a good solid rapport with that person, and you know you're kind of on the same wavelength as far as ideology. Make sure you have some quick reference flowcharts, algorithms, and my favorite, the 3x5 cards, really simple stuff like not this leg, or you know, like whatever, you know, not for IV use, really big, bold letters, you know, that you can't be missed. Put those little 3x5 cards everywhere. Our AED has a huge sticker in the cabinet that says AED inside, so any passerby knows exactly where it is. The first aid kit, huge sticker, first aid kit inside. Make sure you have that on there. And then make sure you got your flow charts. I got an example of some flow charts down here. Web resource that everybody loves, up to date. Who doesn't have access to up to date right now? That is good. You know, get yourself some access. You need up to date. It's just got basic mainstream allopathic standard of care on there, but also has very good differentials, very good algorithms. And I always tell my patients, hey, this is what the mainstream standard of care is. And I say, you should do it. Or I say, I'm not recommending it because my therapeutic order includes trying this first, you know. But always educate your patient on what standard of care is, even if you're going to do something different. And then make sure you know your nearby ER and your urgent care contacts. So Summit Urgent Care, right across the street from Sage Med, I send people over there. If they're just a little higher acuity than I want to handle. We've got Overlake Hospital down the street. Kaiser, it's where we send people for when we send them via EMS. If you're a solo provider, I think we don't have any solo providers here because this is a residency program, but if you're a solo provider in the future, know who's your backup, right? You have to have a relationship with another probably solo provider where you're trading coverage. You can't leave your patient uncovered, you know, and if you're a solo provider, you're going to burn out quick if you don't have coverage because you can't go on vacation, you can't be away from your cell phone. So find someone to swap with. And then of course if you have a team, then make sure you know who's on call for that night. If you have medical staff, make sure your medical staff is trained. If you don't have medical staff, make sure you know who's going to handle those phone calls and whatnot when you're off handling an emergency. For example, if you're a solo provider and you don't have staff, the patient has an emergency and you have to take them to you know, go with them EMS, or you have to manage their care. Who's going to call your next patient and let them know you're going to be an hour late, right? So make sure you have the kind of contingencies in your mind. Other thing to consider in this day and age is what is called situational awareness. Who's taken a personal self-defense class before? Anybody? Oh, just a couple. All right, it's kind of surprising. Everyone should take at least one self-defense class. Unfortunately, we don't live in a utopic society where
Dr. Sage can teach those for you too, right?
I can,
See?
if you're interested. And so there's lots of different kinds of self-defense. It doesn't always have to be physical altercations. When I did my training as a security guard, we were trained in something called verbal judo, which is a way to use your voice aggressively to de-escalate situations. And you'll see police use this a lot. And a lot of times people misunderstand what's happening when they see police videos, when the police just, come in really hard and they're just like, put your hands up, motherfucker. You're like, whoa, that wasn't necessary. But they do that on purpose. They're actually trained to use sudden loud language, profanity, whatever, that they feel in their training is necessary to startle the person into a place of submission. And so I've only had to use this twice in my clinic. I didn't call anybody a mother effer yet. But I've had occasions where men were trying to intimidate my front office staff and getting physically in their face. And so I, instead of timidly stepping between, I very aggressively went in and rapidly de-escalated that position just by using my size and authority. And if you're a smaller size, you have to use your voice, the loudness of it. So get some training in that. If you have a role in maybe a city, or you may be doing a high crime area, you're working in a clinic, maybe doing some compassionate care, some free clinic stuff. Those are higher security issues. I've been in hospitals where just people come in and they're not well balanced and they're ill, maybe addicted. They want to steal all the money you got in your drawer. So situational awareness is being aware of what's going on around you and not getting so lost in thought that you put yourself in danger. Just by where you work. I work in Factoria. It's, upper middle class utopia during the day. It turns into an absolute high crime, shady area at night. And we come clean up the needles and bottles from in front of our door when we open up the business in the morning. So you gotta be aware of who's behind you, who just walked in the door, do they have an appointment? Those kind of emergencies, oftentimes doctors don't think. We're thinking medical emergencies only. But there are also just emergencies that every business owner faces with, but particularly healthcare, because people get upset. A lot of people who become outrageously upset about their medical bills, and they just feel like somehow they're really entitled to free care, and they get really upset when you say no, you actually have to pay for your services, and they become violent. And we've had a couple situations where we've had to de-escalate those people, and then we've had actual threats, made on our staff. A person said to my office manager, who's also my wife, which was unfortunate for them because then I got really verbal judo-y, that they were going to come and beat the shit out of her. And we didn't know how serious that threat was, but of course, you have to take it seriously. Turns out it was pretty serious, and the police actually had to go talk to the man and handle that situation with more legal issues. So situational awareness is important, not just for medical emergencies, but for just running and operating a medical clinic. So keep in mind, some people you're dealing with have mental health issues that can make them unstable and violent, and drug issues, and other just personal stress and finance issues. So that's something a lot of folks don't think about when setting up their clinic. Make sure you just at least give it some thought. And informed consent, give some, right? Always with everything you do, have informed consent on your paperwork, when you do procedures. If you are doing something about to potentially cause an emergency, make sure you're covered, like skin allergy testing. And, there's a very low risk of anaphylaxis there, but if you didn't have a signed consent on file and then they had one, you're kind of in big trouble. So that's part of emergency preparedness too, is providing your patients with informed consent. Here's an example of an algorithm on how to do a drill. And so it comes with a little flow chart and a little checklist. So this would be in a mock emergency. Let's just say it was a myocardial infarction. We place a mock call to EMS. I'm pretending to be the dude down on the ground. Who's in charge now? You know, go through your ABCs. Someone has to go get oxygen, make sure it's working. Circulation's assessed, vitals are monitored. Any other interventions needed? Reassurance, status checks at the 10-minute mark, do this and that. So it's a little checklist that you guys can use in your mock. Who has done a mock emergency in your clinic? All right, not very many. So some of the newer folks haven't had the opportunity to go through one of those. Make sure you get that in sometime during the course of this residency to go through a mock emergency. Any questions about that? Okay. I thought I was blazing really fast for my last presentation, and I actually barely got done in time. And so we still didn't have a lot of time for hands-on stuff, but it doesn't sound like you guys had any specific questions. So I'm going to keep going through this pretty quick. So when we do have a question, we can go into as much detail as you want. This is just a big list. I'm not going to read all this to you guys. Take a quick look. Can I say quick look? Take a quick look. Don't lick anything, please. And let me know if you don't recognize or understand what anything on this list is. So commence speed reading now. Basic first aid. Everyone should know all these things. Good? Yeah.
I don't know what a 16 French catheter is.
Ooh, 16 French. Just use a tourniquet. Sometimes hospitals will use it's a full stretchy catheter. Just use tourniquet. Everyone's got tourniquets in their office. I don't know why that's still on there. Catheter obviously is for urinary retention issues, which I do have in my office because I do men's health. Sometimes I give a guy a little testosterone, the prostate gets a little angry. It's only happened once in 10 years, but I was glad I had both the catheter and a nurse who knew how to put the catheter in, because that was one full bladder. But any other questions about the basic stuff? Also, when tourniquets are in call, or maybe in need, consider using a blood pressure cuff. It's a broader distribution of pressure, and you can get those up nice and snug. Okay, some pro level additions. These are things I added that maybe you don't need, but consider what you do, and also consider your own preparedness, not just for medical emergencies, but for maybe natural disasters, zombie apocalypse, whatever you're worried about. So read through these. There's probably a few here that you may not recognize. Everybody know what all these things are?
No, what makes that dressing particularly Israeli?
Israeli is a particular brand, and so it stops gunshot wounds.
Mm-hmm.
And so they're little square things that you can put right over a gunshot wound. So most of us hopefully will not need one of those.
What are afterbite wipes? I mean, the name seems pretty self-explanatory, but I've never heard of them.
Sorry, which one are you looking at?
Afterbite wipes?
Oh, those are just after you get a bug bite. That's another brand name. You can rub it on there, and it just soothes it. So if you're in if you do wilderness medicine, for example, afterbite wipes are great.
Needle probe and quick clot.
That's a brand name thing again for puncture wounds.
The universal splints for like a finger or
universal splints are for larger appendages,
mm-hmm.
and they're the foldable kind of metallic padded splints,
mm-hmm.
and they can be used for almost any limb. Good? Okay. Now, Obviously, if you do wilderness medicine, some of those are useful. If you're in an urban environment where there may actually be some gunfighting, or if you're in a rural environment where there might be some other other kind of gun accidents, hunting and things like that, then you might want to have some of those other things on hand, because sometimes people, when they're obviously just been shot, they'll stumble into the nearest thing that looks like a doctor, and so they're pretty inexpensive to have these things around. I keep all this stuff not in my clinic. I keep it in my go bag in my car, because I was a Boy Scout and you can't get rid of that kind of training. And so I have this kind of more natural disaster, wilderness medicine, serious trauma kind of stuff in a backpack in my truck. Okay, aloe vera gel, calamine, Imodium, all the OTC stuff. This is all pretty common. Again, we have to take Zantac off the list. It was my favorite H2 blocker, but unfortunately causes cancer. You can still use it in an emergency, but not for frequent use now. Any other questions about the OTC meds? Any suggestions that you guys love and want to share with everyone? Okay.
Can I ask a question? Now,
Yes.
You may have said this earlier and I may have missed it, but now that you're not using the ranitidine, do you have another thing that if you have to do a histamine blockade?
Yeah, I use the, what is it? Smidity? No. I use omeprazole, which is the PPI, which doesn't quite do the same thing for my heartburn patients.
Okay.
And for the other H2 blocker, Michelle, can you Google
I
it?
can look that. I just
Yeah. I forget, I'm drawing a blank on the name. What's the other H2 blocker? Anybody? The other H2 blocker? I'm having a total brain moment. No. See, who's the fastest Googler here?
I don't know if Pentagram is H2 blocker.
No.
Simididine, famotidine.
It is
Yeah,
Simidity.
it's
Okay.
Simidity.
I was right. I was just second guessing myself. Yeah, I used ranitidine exclusively for so long, I forgot. But Simididine, all the itidines. Now let's talk about some RX stuff to have on hand